my focus is the well-being of the dentist. And my answer is the dental leader, becoming a leader and positive leadership and communication for the sake of the well-being of the dentist.
Sure.
What I have found and what I've always believed is where the rubber meets the road in dentistry.
Sure.
It doesn't do this in shoes
Okay.
or commodities.
The rubber meets the road in shoes. Literally.
Yeah, literally, right.
Yeah.
But not, is that you can't commodify dentistry.
Correct.
Dentistry is very personal.
It's a service business.
Yeah, even beyond, it's more intimate than just a service business. I mean,
Maybe it's serving business, right?
But
You're serving.
there's so many emotions involved at
Sure.
every level. And so my feeling is, and this is where the DSOs come up,
Sure.
okay? And we talk about people over profits. We have to be very careful of not putting profits over people.
Right.
And when dentistry has allowed other forces to enter,
Sure.
whether those forces be corporate, insurance.
Sure.
Every dentist knows the little clause at the bottom of the insurance policy that says, we're not here to interfere with the judgment of the dentist.
Sure.
Come on, really? I mean, what narrative is being played out by that clause? Is that building trust in the dental community? But that's neither here nor there. Insurance is here, DSOs are here, corporate dentistry is here. How does Patient Prism help that picture? The doctor-patient relationship and the dental leader and the communication at that level.
As the old saying says, you have one chance to make the first impression, and impressions matter. Patients are finding dentists more so on their mobile devices today. What they see first is that first impression. The first interaction on the phone when they call is that first human interaction. And that really determines whether that patient is going to choose to do business with you. And if that communication can be strengthened, everything else falls in place, because if the patient doesn't show up in the office in the first place, then you have nothing. So really, when Howard Schultz built Starbucks, his first philosophy was, when people entered Starbucks, I want them to smell coffee, right? I don't want them to smell food or anything else. I want them to feel that this is a place where they can relax and work and interact with their friends, and the aromas were important. And that gave rise to, people were paying, nobody paid $1 for a coffee before Starbucks. All of a sudden you paid $9 for a venti now.
Yeah.
So it is all about, so when you're trying to compete in this highly commoditized world of dentistry that it maybe is happening, is that how do you distinguish yourself as a high quality provider that believes that dentistry is more than just a crown or just a bridge, is by delivering that amazing customer service experience that is consistent from when they find you to all the way to leave the office. And Patient Prism facilitates that first interaction with the human being that's going to make that experience even better. And we're seeing the results. We monitor that and we quantify that on a daily basis.